PHEOCROMOCYTOMA. PHEOCROMOCYTOMA definition is a rare, usually non-cancerous benign tumor that develops instead in the center of an adrenal gland. You have two adrenal glands, one above a kidney. Your adrenal glands produce hormones that give instruction to virtually every and tissue in your body.
Which is removal of the tumor or removal of the entire adrenal gland, there will be a reduction in blood pressure in many. However, 10 to 30% of these patients will still have persistent hypertension or high blood pressure. Treatment might include a calcium channel blocker to control blood pressure or a beta blocker to decrease the tachycardia. So patients that have pheochromocytoma and get treatment need to know that they will have to have follow-up care with blood pressure monitored regularly, as persistent hypertension may be a problem.
Application in medicine. Pheochromocytoma is a rare tumor that usually starts in the cell on your adrenal glands. Although they are usually benign, pheochromocytoma often cause the adrenal gland to make too many hormones. This can lead to heated blood pressure and cause symptoms such as headache, sweating, pounding of the ear, vein escape, vein strep pain. Sometimes pheochromocytoma is part of another condition called multiple endocrine neoplasia syndrome. People with may after have other cancer and other problems involve hormones. Doctors use lab tests and image to diagnose it. Such is most common treat. Other options include radiation therapy, chemotherapy, and thyroid therapy. Together, therapy use substances can attack cancer cells without our normal cells.
The adrenal medulla, called a pheochromocytoma. It is a beautiful tumor for many reasons. One reason is it's one of the rare causes of hypertension that can be diagnosed perfectly with a physiologic challenge test, and it also can be cured simply by taking it out if it's functional. Uh, it is even more of a true adrenal medulla tumor than a neuroblastoma. Another reason why this is really kind of an exciting tumor as we kind of scan through it here is that you can see there are some neurosecretory granules in some of these cells. You can also see that it is a very, very considerably vascular tumor. But the most exciting feature about pheochromocytomas, from a pathologist point of view, it is they're almost always benign. You know, I don't think I'll live long enough to see a case of a malignant pheochromocytoma. You hear about them. Maybe if you're lucky, you see one in your life. But the thing about pheos uh, is that they can have extremely large, bizarre, irregular looking nuclei and be totally benign. Some of the most bizarre, large, yucky, scary, malignant looking cells I've ever seen were in benign pheochromocytomas. And for all practical purposes, let's just say they're all benign. Notice how extremely vascular the tumor is. And really, all of these are blood vessels. Here's blood vessels. Here's blood vessels.